Welcome to a session that promises to be nothing short of extraordinary. And the reason I'm using the word extraordinary is because we are very fortunate to have with us two global leaders who are going to transform the way and reshape cancer care in the world. So welcome, thank you for joining us.
Thanks
and
so
my
much.
first question is to you, Vivek, which is you're a man with a plan and you have a very grand plan to cure cancer. So can you tell us about it and also what is India's role in it?
I mean, I lost my wife to cancer, so it became very personal for me.
Closer.
So it became very personal for me to cure cancer itself. Keith was one of the amazing scientists who helped me. We tried every possible means to save her. And I realized how screwed up the American medical system is. I call it corrupt, incompetent. I mean, everything bad you would ever say about a third world country, that's what I started saying about the US medical system. So I was destroyed after I lost her, and I decided that I'm going to do what I teach. I was teaching advancing technologies, everything from AI to quantum computing. So I said, well, let's figure out how to cure cancer. So with the help of Keith and a bunch of other amazing scientists, I put together a grand plan to cure cancer. And what's the grand plan? To get all the data and the biosamples we need to cure cancer. And as I said, the US medical system is as broken as could be. So it occurred to me that the best place in the world to do something transformative is India. Why India? Because India has no legacy to protect. So it took a lot, but I got a meeting with Prime Minister Modi in Kevadia, Gujarat in 2019, and I spent nearly an hour with him. I was amazed at the discussion we had. At the end of it, he told his people, do whatever it takes to help Professor Wadhwa. So another long story, but eventually connected with Venkat Ramachandran, who was Ratan Tata's head of Tata Trust, and Moni Abraham Curicos, one of the greatest oncologists in the world. And they were looking to transform India's cancer care system by setting up a distributed cancer network. So we teamed up, and Keith and a number of other American scientists started working to help Carcanos leap beyond anything they could have imagined, and to transform not only India's cancer care system, but to make an impact on the whole world. And I'll let Keith tell you more about what he's observed and what he thinks we should be doing.
So Keith, question to you. Why do you think this plan will work?
Well, it's really all about connecting capacities and technologies that is what's already happening, and really at a faster pace than I thought imaginable. So playing that forward over the next 2 or 3 years, I think what Vivek is alluding to is that we're at a point right now where we have diagnostic technologies, maybe not even yet diagnostic technologies, but methods for interrogating biospecimens at the DNA, RNA, protein level that allow us to really see all of the complexity that cancer represents. I mean, truly the most complex of all human diseases. But that technology is not applied to specimens and not combined with patient data and patient outcome. This is the problem. I mean, Vivek, if I were to just wind back a moment to the way he tells his story and how we met, to just weave in this, my view of that experience, which is that Vivek's wife had been receiving sort of standard cancer care, a couple of attempts already by the time we got in touch. And he was put in touch with me, again, we're on opposite sides of the United States, so this was all, phone call, email type of exchange, and we were going back and forth about, well, what next? What could be sort of the cutting edge approach that she could consider? And so I laid out, if you will, the game plan, which is simply that, well, we need to do another biopsy. We need to actually take that biopsy specimen freshly to the laboratory, have it maintained or propagated, and have drugs screened directly on it. And Vivek said, I'm paraphrasing, well, that sounds so obvious. Of course we should do that. Why am I hearing about that now for the first time? And And then he kept asking questions along similar lines about, well, why are all these sort of scientific ideas out there and not being applied now for my wife who's dying of cancer? And everybody who faces a cancer diagnosis is similarly in this very time-pressured situation. Vivek's wife, extremely so by the time we got connected. And this was really what created the energy that led Vivek first to the White House, I should say, in the United States, and then to India, because he started seeking his own answers to the question of why is the science and the medicine so far apart, as was the case for his wife. And the answers he got in the United States he didn't like. He came here and met with the Prime Minister and several of his ministers. This is before I got involved. And then got connected with this utterly remarkable entity that we'll talk about, Carcanos Healthcare. But again, just to circle back, so many of the components exist, not just in the US, I mean, globally, in scientifically advanced countries like India. The pieces are there. They have to be brought together. And unfortunately, in the United States, and I would say in Europe, perhaps even more so, there are impediments that are going to prevent that from happening for the foreseeable future. And that's not true here.
So I've heard that you're moving, Vivek, you're moving your R&D to India. So is that the reason why? Why India? Because you're based in the Silicon Valley.
Yeah. So just let me tell you about what happens next. So Carcanos Healthcare has built already the most advanced cancer care system in the world. The IT infrastructure that they have, when we told the White House about it, the cancer moonshot about it, they were blown away. What the head of the US cancer moonshot, Daniel Carnaval, said was, oh my God, we were talking about this happening in the next 5 to 10 years. This is what has already been built in India. They're implementing it at a scale that is unprecedented in the world. So what's happening in India is amazing. Move forward 5 years, India will have the best cancer care system in the world, thanks to the work that the folks at Carcanos is doing, and to the help that Keith and Aparna Parekh and Mitesh Bhatt and a whole bunch of people are giving to Carcanos. So that's happening. Now, what my colleagues at Carcanos realized is that we're catching cancer too late. I mean, all of you have relatives, friends who you lost to cancer. I'll bet you there's not one person in this audience who has not been impacted by cancer personally. In India, it's almost always at stage 4, when it's too late. You're desperately trying to get drugs which are not available. It's a hopeless cause. So what Venkat and Moni started doing was they started doing early screening. Because if you can catch cancer at the earliest stage, you can treat it. You can now go back to natural remedies. In India, Ayurveda, for example, and holistic health are very strong. Well, if you know that you're going to die, if you don't change your lifestyle and habits, you're going to change your lifestyle and habits. What do Indians do normally? They fill themselves up with chemicals and processed foods and smoke and God knows what else. You're killing yourselves rather than going back to your roots and eating healthy food. So this is what becomes possible if you can diagnose at the earlier stages. Now, in reviewing the progress Carcanos has made, they had screened about 1.5 million people over an 8-month period. The trouble is that they're just doing superficial screenings. The poor can't afford blood tests, let alone genetic sequencing, which is, at Harvard and the patients that Keith treats, routinely they'll get complete genetic sequences, and then they treat based on the mutation you have. Very few people in India can afford that. So this is the problem I decided I'm going to solve myself. If I can now be ambitious and talk about curing cancer and having India lead the world, there was a technology that I had access to in Chile that I had invested in that converts water into plasma back into water. The company is Plasma Waters, and they are about to launch the next green revolution in India. But a byproduct of that technology is the ability to ionize any fluid. So what I realized is that we have a chance to disrupt the entire medical diagnostics industry, because the way blood testing is done right now, you take a sample of blood, you put it into microcontainers, and you run immunoassays on it. So you're testing specifically for certain things. What if you could now convert organic matter into light spectra and then use the advances in AI to analyze that spectra? Well, you need a lot of data for that. You need data at a scale which is not available by any means in the West. Keith, when he wants, Keith and his colleagues, when they want to do studies, if they can get 200 or 300 samples, that's a big deal. They get very excited about the research that they're doing. Here, we need hundreds of thousands of samples. Well, guess what? This is, at IIM's, AIMS, or Tata Memorial, this is, how many patients they'll see in a month. So India has all the data, it has the need, it has the scientists. This is why I decided, literally yesterday, I met Ajay Sood, the Prime Minister's scientific advisor. I met the head of AIMS, M. Srinivas, and I met Hardik Shah, the Prime Minister's private secretary. And all of them, were telling us about what is possible in India. So Keith can talk about AIMS and the amazing faculty they have here. But I decided last night that screw Silicon Valley, I'm moving to India because I can do things at a scale which is unimaginable in Silicon Valley. Literally, for the last few weeks, I've been going and hitting up venture capitalists over there, people who used to suck up to me in the past. So I've been, trying to raise $5 million. The arrogance you get there, when I mention India, they just sort of turn off. All they wanted, because I've said my goal is to cut the cost of medical diagnostics, hundreds of tests for 100 rupees. That's what my goal is. They say, well, why India? Who cares about India? Let's charge $100, $500 for this thing. And I'm saying, I don't want, what I decided was that I don't want their money. I don't want these conditions. I can come to India and cut the cost down by an order of magnitude and fund this myself. So that's a decision I made last night that I sent a text to Sukumar about, and he wanted me to talk about it.
So Keith, what is it that excites you about India, working in India? Because you've never been here before, right? You've traveled 4 times this year, so...
Right, well, I've never been to India before this year, and I've been here 4 times because of what I witnessed in January. After being connected with Karkanos at the time the company was first forming in 2020, we could only interact on Zoom. That was incredibly unsatisfying for a variety of reasons, but two really principal reasons. One is that I've learned that entrepreneurs, scientists, and doctors in India, through the lens of interacting with Karkanos, and now through those interactions, now interacting with more and more of each of those constituents, beyond Karkanos, if you will, at the publicly funded health institutions and research institutions and the like, they have a really disorienting sense of humility. Disorienting for a Westerner, because humility is not a thing that is a cultural norm. Even worse on the west coast of the United States, where Vivek has spent his career.
Arrogance is looked up to in Silicon Valley.
In any case, the point being that what was happening then was quietly somewhat out of our view, because we couldn't come to India until the beginning of 2023, when sort of COVID cleared enough, was that this team, rising out of the Tata Trust, which I want to emphasize that there is no Tata Trust anywhere else in the world. I mean, I just want to be very clear, having traveled the world, doing the work that I do, trying to advance science to medicine in oncology, there's nothing like it. And that foundation and that culture and those people being the very ones who then were responsible for creating this now for-profit company, but one that behaves in a way that's not at all like a for-profit company that I've ever interacted with. Basically, what they've been able to do is put together infrastructure, 5 laboratories that are absolutely cutting-edge molecular diagnostic laboratories. They've launched these population-based screening campaigns the numbers are astonishing and exponentially rising. Of course, the Indian population is astonishingly large, so the numbers need to exponentially rise. And as I witness their ability to create this sort of capacity, bring together the technology in these laboratories, to bring technology, and here I mean not biomedical research technology, but what India is so wealthy in, which is tech, knowledge, know-how, and tools, and to bring that for the purpose of screening rural populations who've never been approached ever before for cancer screening. We witnessed this for the first time in January. in a 3-city, 3-state, week-long tour, ending here in Delhi. And it just became clear to me that we're in the West, and again, US, Europe, put it all together, we face headwind. We are up against impediment after impediment in terms of doing these things that are obvious, that need to be done, where you need numbers, right, to be able to actually really unpack the complexity of cancer biology, develop new diagnostic tools for early detection. And here there's tailwind. There's just something fundamentally, culturally different. And the alignment from government to publicly funded research institutions to physicians to companies is just, it's astonishing. And again, I'll keep coming back 4 times a year for as long as these conditions remain, because it's because of this that you play it forward a very short time, even 1 year from now, this enterprise that Karkinos is pulling together with many different types of constituents will produce more data points connecting patients' cancer diagnosis, their molecular composition, their treatments, their outcomes. And this is the learning cycle that we've been starving for, but we cannot create it because constituents are simply not aligned in the West.
Sujit, I want to add one more thing about Indian culture and values. Venkat and Moni, I just mentioned them, they're donating the majority of their stock to a trust for cancer patients.
Oh, wow.
They're taking nothing about it. The humility. The White House, when Modi came to the US a few months ago, they announced that the US and India are going to be working together on cancer. And Karkinos was actually mentioned in the White House press announcement. Venkat and Moni won't even talk about it, humility. I said, Venkat, what's wrong with you? Why aren't you He says, no, our actions have to speak for themselves. I said, Venkat, you need to promote what you're doing, because otherwise no one's going to know who you are or what you are. He says, no, we have to be modest. The value system that you have here of people who are doing good for the world, you don't see anywhere else in the world. Keith has never seen anything like it. I've seen nothing like it, even though, I've been born in India. The fact is that this is the beauty of Indian culture and values. It's all about giving back. This is why, last night, I actually went to Heartfulness Institute. 3 days before that, I did yoga, meditation, Ayurvedic massages, because I was burnt out after having started this company. While I was there, I started thinking that, this is my country, these are my values. Why am I now focusing my R&D on India? Why am I sucking up to these evil, stupid venture capitalists in Silicon Valley when I have the entire values and culture of India that I can take advantage of? I've met a bunch of college grads over here. It's just unbelievable. For example, one of them is here in the background. He's going to be my first Indian employee, Agam Madan. He's graduating from Delhi University in April, May. He says, look, I'd like to be an intern. I don't want any money. And I said, okay, what salary do you want when you graduate? He says, well, 6 or 7 lakh are what people are making. And I could calculate that's like $7,000, $8,000, which is 1/15th, 1/20th of what it would cost me in Silicon Valley for someone equally smart, equally motivated. So I've been interviewing people there. When I interview graduates from US colleges, they know anything about AI. If they know how to spell AI, they want $150,000 salary. They want to work 35 hours a week. So what Agam says to me is that I'll work 70 hours a week. And I told him, how about $10,000? He says, that's 8 lakh rupees. Wow. So that's the type of reaction you get here in India versus the arrogance of Silicon Valley. And in Silicon Valley, people feel entitled to do 2 or 3 jobs. Moonlighting is the norm over there. It's not something that California laws allow it. You're not even allowed to stop them from it. Here, Narayan Murthy talks about 70 hours a week and people freak out. The people who are joining startups want to work with that excitement and that value system. They want to do good for the world. That's why I'm coming to India.
So Vivek, I'm going to come back to the Prime Minister again. You met him in January. So what's the progress that's been made after your briefing? And also I'm interested to know, what was Prime Minister Modi interested in when you had a long conversation with him?
So when I met him in 2019, I walked him through what was happening. I was amazed. I was told, here's what you can do with the PM. You don't talk too fast. Don't say this. Don't say that. Modi and I were like friends talking to each other by the time we were done. And his people were panicked that, the way I was talking to Modi, I was literally talking to him as a friend. And then I came back and I said, dear Prime Minister, I want to thank you for what you enabled. I said, it's only because of you that I put the grand plan together. It's only because of you that I got this advisory group together. It's only because of you that we're helping Karkinos. and you have made all of this possible. He was just amazing. Keith, provide your perspective about your meeting with the Indian Prime Minister.
I mean, it's astonishing. We don't have public figures like that in the United States, so it was hard to be prepared for that meeting. We'd been told, if you're lucky, 15 minutes. The Prime Minister's a busy man. We had 50 minutes, 50 minutes, where he was directing the conversation, probing, the areas, and really looking around the corner, if you will, of where this is all headed. By the time we got to the later parts of the conversation, it was sort of, I think, obvious to him and obvious to us that what we were talking about was not only closing a gap. I mean, right, not only trying to sort of, if you will, catch India up, which honestly we have so much unmet need in cancer. Just to speak, from the perspective that I have about how frustrated I am by the sort of stagnation, if you will, that's been realized in the U.S. We need to pass by the current standard in the U.S., right? And that became very clear to the Prime Minister through the course of this conversation that that's exactly what was happening. That essentially, there's this sort of slingshot opportunity by bringing together these constituents that are, willingly, enthusiastically coming together now. Basically, we have the opportunity to actually have India be the hub. And ultimately, coming from Boston and Cambridge, Massachusetts, which are right immediately next to each other, which is the world's biomedical research capital. I mean, it is the biotech hub of the world. There's nothing even close to it. The next biotech hub, at least for cancer research, is going to be here.
Oh, wow.
But I'm quoting from the conversation with the Prime Minister because it was just, as he was following kind of where these dots were leading, he saw it as clearly as we did. And that type of vision and the conversations that we had the day before with the heads of each relevant ministry across science, healthcare.
Rajesh Gokhale, Ajay Sood, it was the Secretary of Biotech, the principal scientific advisor. These are the people we're talking to, and they're so committed. They really get it. They really care about the country. This is one thing you don't see.
And they're excited by science, which is like...
Yeah, it's right from the top, from Modi down, we've been blown away with what we've seen in India.
But tell me, all these cures and solutions that you're working on, how accessible will they be to, to the global south? Because now India is emerging as
bionics. My ambition is to be able to detect every disease. Just like when genetic sequencing first happened, when DNA was sequenced, we turned biology into letters. I'm turning biology into light. And the magic happens here when you train your AI. India, we have all the data we need.
But will I be able to afford it?
Literally, my goal is 100 rupees to do a test, and not only blood test. I'm going to start with breath tests because like TB, H. pylori, there are a lot of diseases you can detect in the breath itself. Certain cancers you can detect in the breath. And then
will
you
it
have
be
urine.
all cancers or just lung cancer? Just tell us something more about your
Keith is expert over
breathalyzers.
here. Some cancers may not show up in the breath. For that, you may have to do blood tests. But my goal is to detect every disease because it's become an AI problem. Actually, that's the magic of AI. And this, I also learned, Hardik Shah told me yesterday that the Prime Minister is planning to spend $800 million, nearly $1 billion, on setting up an AI infrastructure in India. $1 billion is like $20 billion in the West. So if India does that, it has the data, it has the people. All these graduates coming out of school, they're highly motivated. India could become, not only lead the world in curing cancer, it could become the world's AI hub in the next 3 or 4 years, if everything goes the way expects it's going to be. Because solving the grand challenges of humanity now is a data problem. And AI enables you to understand data. And if you have the skills and everything necessary, magic can happen. So this is India's opportunity.
Keith, my question to you again. How does it work, breathalyzer for cancer?
This technology?
Yes.
Yeah. So this... basically, the method that Vivek is describing is distinct from our other ways of trying to analyze biological specimens in that we go hunting for specific types of analytes, if you will. So the early detection methods that have been really I would say, exploding in terms of the evidence that they can find cancers that we could never find early before, but not as reliably as we'd like these tests to work. They try to pick up so-called circulating tumor DNA. So from a relatively early point in cancer formation, DNA is shed from tumor cells. DNA is also shed from other non-tumor cells, of course. And those are rare events, if you will, in a small early cancer. And if you put your blinders on and you're only looking for that type of analyte, you're giving up a lot of the potential detection power. This method is essentially agnostic to what the analyte is, right? So regardless of the nature of a complex macromolecule or a specific small molecule, or even a simple analyte like sodium, this method basically can detect all of those species in a way that current methods that manipulate a specimen before analyzing spectra don't allow. So basically this sort of unmanipulated approach allows you to basically take a specimen, vary the temperature, vary the pressure, and vary the power supply. And across those 3 dimensions, basically understand through the photospectra the surface features, if you will, of all of these molecules, again in 3 dimensions. So there's a depth that this method can probe that no other method that we have currently can. Cancer is complex. I mean, it's an inflammatory disease. It's a disease where there's a lot of communication going on between the tumor cells and non-tumor cells in the body. That leaks out, if you will, into the bloodstream. That's why we think the blood is such ultimately an important compartment to be able to characterize. And again, this method can potentially wrestle down that complexity. So we're all very excited. But these approaches, including the blood-based early detection methods I mentioned in the West, they are going to take a decade to advance in the West based on our inability to pull together diagnostic technology, screening, broad-based population screening, data on patients' data and their outcomes. These things can't come together. And when we talk to the companies that are developing these blood-based methods that I referred to about this enterprise since this visit in January, their jaws drop, and every one of them is lining up to basically partner with this platform that is itself a company, but is really, truly a platform. And Vivek's method, the same.
My goal is within a year to prove the technology and to have, I'm going to have several devices available to different universities. This is why I met the AIMS researchers, brilliant faculty. I'm going to make it available to them, let them do the discoveries. I think within a year I'll be able to prove the technology. And if it works, I'm going to disrupt the entire medical diagnostics industry worldwide. It's going to happen from India, made in India, research in India, papers published in India. That's what my goal is.
But let me just, you asked about access or accessibility a moment ago, and I want to squeeze in one really important point. India can drive a diagnostic revolution on its own effectively, based on everything we've talked about so far. Where we need partnership is in the therapeutics. Access to therapeutics in India is a major problem. Cancer therapies, very impactful cancer therapies, that when applied particularly early, here I mean drugs, specifically drugs, they are out of the reach of the vast, vast majority of Indians. And that's unacceptable. To make this whole research engine that we've talked about work in the population of patients once they're diagnosed with cancer, we need access to therapies. And for that, we need partnership. This is really my ulterior motive in participating in this event, is knowing how many leaders are present here who have connections to multinational corporations, as do I, but we need partners. That's large pharmaceutical companies, some biotech companies, therapeutic developers. They need to see the opportunity to help the entire world through this enterprise. And so, I'm campaigning, I am petitioning, imploring my colleagues in pharma and biotech to rise to this opportunity. And again, I need all the help I can get.
So we have a minute left, so this is my last question to both of you. Very quickly, the possibilities are limitless. So what's your vision for the future?
Sanchez, I want to cure every disease. I want to, first of all, prevent it from happening, catch it early. Because, yes, therapeutics, but I also believe in Ayurveda. I believe there's a wealth of knowledge here by which we can start treating ourselves in holistic ways. So I'm a big fan of holistic. So, yes, I'm working with the scientists and I believe in Western medicine, but I also believe in Eastern medicine. So I want to see us living healthier lifestyles, being able to diagnose disease and then to cure all disease. This is what I want to see happen in the next decade. That's my vision for medicine.
And Keith, your vision for the future? Especially after your travel to India.
This hyper-collaborative model that we've tried to describe, I mean, it is going to set the example for the world. I mean, the model that's being created here, and literally the digital platforms that tie it all together, they are going to be portable to even more challenging environments to navigate, Africa. They are also going to be ported to the United States and Europe, right? This concept, this hyper-collaborative concept, it could not have been started in the United States, but it can certainly be borrowed by the United States. So I'm here to try to do the work that I've been trying to do in the United States, because it's going to happen here first. And that's going to have global benefit, as I say, sort of upstream and downstream, if you will. India, of course, itself has everything, right? I mean, which is to say, everything from poverty to wealth, has every dimension, if you will, all packed into one very large populated country. So I really think this sort of what we're describing is an end-to-end solution that is going to have global relevance.
Thank you so much. Thank you both.
Thank you, everyone.
Thanks, everyone. We don't have time for questions, but they're going to be around all day, so please feel free to walk up to them and chat, whatever. Thank you so much.